Hi, let's continue. If you're new here, you can go to the trailer, and if you're lost, you could go to the table of contents. About Lurasidone, well, the bottom line is it's the first of the next generation of antipsychotics to become available as a generic, and finally then at a lower cost and more available. So its advantage is that it clearly is less likely to cause weight gain and metabolic syndrome than all of the ones that preceded it in that second generation that we use so commonly now. Um, but the risk is not zero. And tardive dyskinesia, the other big risk of antipsychotics, probably not as much. We don't know for sure. There are just a couple of case reports about that so far. Because it's a new medication, it just takes longer to figure out what the risks really are. And finally, the dosing is a little tricky, but not impossible. Its big advantage is that it has shown benefit across the whole spectrum of bipolarity. So it's not so important then to know exactly where on that spectrum you are. This could be helpful no matter where you are. And in particular, in mixed depressions, it's one of the few medications that's been studied so far. And so it's routinely recommended now in the more recent guidelines. The problem with the guidelines, as I described in my other video about that, is that they're strongly determined by pharmaceutical money, providing the money for the research that gets the results, that gets the indications that go in the guidelines. And so instead, as you may have read in my other or seen in my other videos, lamotrigine and low-dose lithium is what I think I was using in that mixed depression realm, at least as a starting point. Their risks are much better known um, and in my experience, um, certainly effective enough to justify their use compared to lurasidone. With Lurasidone, though, I'll admit I don't have a lot of experience with it because it actually became generic after I stopped seeing patients. So I only had a chance to use it a little bit. Interestingly, in that little bit of use, I did see it cause weight gain, even though it's often said that it doesn't do that. I saw it induce hypomania, like acting too much like an antidepressant a couple of times. Um, and I did find it a little tricky figuring out the dosing, which is related to when you have a meal. Um, that doesn't make it impossible, but it would be worth working with someone who's familiar with this medication to know how to work around that. So in summary, it has benefits across the spectrum of bipolarity. It may have particular value in mixed states, but it's not the only thing that could be considered there. And it's not absolutely low in risk. And I think we have more to learn about what the risks really are, but it's lower than the generations that preceded it, um, even though it's not identical in terms of the way it works. I'm going to link my lamotrigine video and my low-dose lithium video and that rant about how I don't follow the guidelines. Thanks for watching.